what we're going to see in the next video and the next presentation. It's called Dying to Be Heard, and we're going to hear the story of Adrienne Moore. Thank you all.
My name is Adrienne Moore, and I am an endometrial cancer survivor. Before I was a cancer survivor and advocate, however, I was a sister, a daughter, an aunt, and a healthcare professional. I spent my time writing and hanging out with friends and doing the things that young people do before they realize they have, limitations, that there are things in life that become more important than just your whole social being. I was the woman who wanted to, travel and see all the great things that the world had to offer. And that was all before I found out that I had cancer. That was my first thought, concern, care was I going to get the same type of health care that I was getting? Would I be receiving that same type of care and concern that I was giving to the world? Was I going to get that back from the people who were supposed to care for me? If you don't have health care, you don't have identity when it comes to you don't have a choice in how you're cared for and who you're cared for by, right? So you're left at the mercy of the good-hearted persons who either take the time to listen to your issue and direct you to whom you are supposed to the care that you're supposed to receive, or you're left to someone who just doesn't have the time, nor do they have the desire to interact with someone who doesn't have health care, because there's a block there. There's only but so far you can go if you don't have health insurance and if you can't pay for things out of pocket. So though I was able to maybe perhaps pay out of pocket to go see my primary when I was having issues related to this particular cancer, if he were to give me a referral to go someplace else, if that referral only took a certain insurance or did not see self-paying patients, then that was a roadblock. And more or less, you tend to give up just a little bit, because it's very taxing and trying to continue to be told, well, I can't see you because you don't have insurance. I can't see you because this visit will cost you $300, and I would also need to have you go and have more additional tests, and unless you have this much money to put, I can't see you because there were a lot of can'ts involved when it came to not having health insurance. And one of those things was that you might, and this might not be the correct diction, but you might can't live because you don't have health insurance. And that is, I think, was the biggest thing that I noticed, was that despite not having health care insurance, we all still deserve to have health care. We all still deserve to have life. And I was told in so many different ways that my life was expendable because I just didn't have the access provided to me by an insurance card. Unfortunately, with endometrial cancer, most of the symptoms mimic those things that happen or tend to happen to Black women in general. We have fibroids, we have PCOS. There are we are high propensity for obesity. So when I was experiencing symptoms and I was missing my periods and I was having heavy periods, I checked all the boxes for why this was happening, because you're a Black woman. So before I even had a chance, or before there was even a chance for anyone to actually explore anything outside of why I might be experiencing these symptoms, there was always the default of it was because you're a Black woman and this is your history. Your history as a Black woman shows that you do have a high propensity for fibroids. And we're seeing them now because you have cysts. Or as a person who previously had ovarian cancer, yes, it's more likely that you're experiencing perimenopausal symptoms at the age of 42. That's normal. So I spent a good deal of time as a black woman being normal, having my symptoms being normalized. That's what's dangerous. The normalization of things that essentially are things that can lead to your mortality. And in this case, it was endometrial cancer, because before I was a stage 3, when I was finally diagnosed, when I finally got insurance, somewhere along the lines, when I was talking to my primary care and he was sending me someplace to have a test done that I was paying for out of pocket, I might have been a stage 1, where I might not have had to have surgery. I might not have had to have chemotherapy or radiation. I could have just been able to live with my whole self, with my whole reproductive self, past this cancer. But instead, I was diagnosed at stage 3 and consequently was very close to losing my life. First, let's talk about how it makes you feel about yourself. Just not worthy. Because all around you, you hear and see all the things that make sure that other persons of other races are heard. Whether or not it comes to breast or lung, and even now to a certain extent, cervical. But for me, it made me feel as if I was making a lot of these things. I second guessed myself. I had a lot of self-doubt. My confidence, which had always been very high because I felt connected to what I did as a profession and you know, the type of education I had and my friends and where I lived, all those things. And then when it came to this, I felt as if I didn't matter. And that takes a toll on you and almost makes you feel as if you're not worthy of the care that you know you're deserving of. Like, maybe this is my lot. If no one's listening, maybe I am making these things up in my head. Maybe I am going to be okay. And it's justifying, I think, when you find out that you're not crazy. It wasn't just in your head, but it's also just you get taken aback a little when you find out that you have this thing and you've been telling and yelling and screaming anyone who would listen to you, hey, something is wrong with me. And I know, because I know my body. And when they dismiss you and send you on your way, only for you to come back 3 months later for them to give you this devastating news of having this cancer, in which they say, there's a good chance that you may not survive, then you just feel like people were just willing to throw you away, no matter what you did with your life, no matter how good of a person you were, how good of a caregiver you were, how articulate you were, how many times you wrote it down. Let me write it down so you can understand. You kept a diary. All the things that you did, all the things they tell you to do now that I learned when you're an advocate, to take action and to ask questions and to come there and be prepared by writing down anything you don't understand and then making sure they explain it to you until you do. All those things that I did, it felt like none of that stuff mattered. As a Black woman, your color, walks through the door before anything else, before I even open my mouth, the first thing they see is a Black woman. And then when I start to tell my story, the second thing what they hear is the story of the many Black women before me. And that's unfortunate. It's unfortunate because even though we all might have similar stories, our outcomes all have the opportunities to be different. We can all take from the experience of one person and learn that that's not the way you should treat the next person. So that's what I hope. That's what I hope from what people hear from out of my story. We talk a lot about treatment. We talk a lot about symptoms and early diagnosis, but there's not a lot of conversation happening around getting involved in research. And I don't know if that's by design, but I do know that if we're not comfortable discussing clinical trials, if we don't make it part of the regular conversation around when it comes to this is part of a treatment profile, we don't start to talk about it as if it's and make it common language, kitchen table language, then Black women will always feel intimidated by it. We'll always feel like we're outsiders looking in, simply because we're not educated towards it. We're not geared towards it, and simply because we're not asked. If you give someone the option of being a part of a clinical trial, not because we want to experiment on you or because we think you have what it takes to find a different cure, but because you want to be a part of something that in the long run is going to help everybody, I know that they will say yes. When we talk about health, we need to talk about wholeness. What makes us whole? And what's going to make us whole is to have relationships that we feel are worthy of our time, are worthy of our trust, things that we can believe in. So many people don't go to the doctors because they feel like doctors are pushing medicine. Same way people don't go into clinical trials because they feel they're going to be guinea pigs. So we need to change the conversation about the why of healthcare, right? We need these things. This is something that is the same way everyone deserves water. Everyone deserves healthcare. People trust water. They turn on the tap water, the water comes out, they drink it. It's because it's been ingrained in us that this is safe. This is something that we need in order to live. Healthcare is the same thing. We need it in order to live. So let's talk about it in a way that we're going to give it, it's going to be accessible to everyone and not something that's just given to people who are deserving of it, because we all are. We all are deserving of life. We're all are deserving of health. What we have to discover is a way to trust each other in sharing that health, in sharing that experience, in sharing that information so that we can learn to trust each other. I want to trust in my providers the same way they want to trust in me. And that, I think, will make a big difference in how we approach healthcare and how we approach how often we go to the doctor and how we approach what we believe when it comes to our doctors and providers telling us, you don't come into your diagnosis wanting to be an advocate. You don't think that this has anything to do with anything other than your cancer. But in fact, it has so much, it's tied so much to your humanity. And I think that's important. We all want to feel like we have dignity, even in cancer. So yes, if I could say anything, I would say that people don't change because they have cancer. We don't deserve less because we have cancer. We don't deserve more. But we definitely deserve the best chance at living our best life to and through cancer. So even though everyone might not have the experience of having an endometrial cancer like myself or an ovarian cancer like myself, we can all have the experience of advocating for those who do.